just received your fertility hormonal test results, and they are showing that your TSH is high, your testosterone is also high, your prolactin is also abnormally high. You are asking yourself, what is the meaning of all this? Remember, the results are also showing that your T3 and your T4 hormonal results or hormonal tests are within the normal ranges. In other words, your TSH is high, prolactin is high, and testosterone is high. T3 and T4 is within the normal ranges. You are asking yourself, what is the meaning of all this? You are holding the report and you are asking yourself, how can you interpret this? How can, could someone explain for you these results so that you could understand them much more better? This video is for you if you have just done the test and the results are out and you are asking yourself, what is the meaning of all this? I'm called Gerald Massa and I'm a certified and licensed fertility coach, stroke hormonal health educator. If you want to learn everything about your fertility hormones, you want to learn everything about your fertility, and then this channel is for you. You are most welcome, and let's get straight to business. So when the report is showing that your TSH is high, we shall begin with TSH. What is TSH in this particular context? You realize that TSH hormone also in full, it means thyroid stimulating hormone. Thyroid stimulating hormone would basically, if you are asking yourself what TSH means, T stands for thyroid, and then S stands for stimulating, and then H stands for hormone. Remember, thyroid is that small gland, it's that small organ just in the front of your trachea, and then it is actually butterfly shaped. Its main functions are actually to produce several hormones. These could include T3, T4, and calcitonin, among others. It is a gland which produces these hormones, T3, T4, and they are responsible for many functions in a woman's body and also in a man's body. Some of these functions of the thyroid hormones include proper metabolism, proper growth, and then proper cardiovascular function or cardiovascular activity. In other words, these hormones known as T3 and T4, they help in how well you are going to grow. They help in how much weight you are going to put on. They kind of play a very important role in regulating the amount of weight someone's going to put on. If you are struggling with losing weight, if you are struggling with issues with cardiovascular conditions like high blood pressure, you are a woman but you are asking yourself, where did the blood pressure come from? In most cases, you could discuss with your doctor, and then your doctor will be able to evaluate you for the T3, T4 hormones. Remember, my videos are for educational purposes only. Let's stay on track. So the question was that she did the fertility hormonal tests and TSH was high, and I was saying that TSH, also known as thyroid stimulating hormone, it is a fantastic hormone that is actually produced in the brain of a woman. TSH is a hormone produced in the brain of a woman. You might ask yourself, the brain has many parts. Specifically, which part of the brain? It's produced in a small part in the brain known as the anterior pituitary gland. For TSH hormone to be produced in the brain, there should be a command, there should be a message that should come in and then tell the pituitary gland that, you know what, you produce the TSH. What normally brings about this, or what sends the command, is what we call the thyrotropin releasing hormone. So TRH, thyrotropin releasing hormone. If you are holding your report, you've just received your report probably from the laboratory, or they've just delivered it to you, and you are asking yourself, I've received this report, they're telling me TSH is high. What is the meaning of this? The meaning of high TSH is that particular part in the brain that is producing the TSH, the pituitary gland, it is actually getting kind of lots of messages from the other hormone known as TRH, thyrotropin releasing hormone. the thyrotropin releasing hormone is actually sending lots of heavy, we could actually say it is receiving big signals, big messages that you know what, pituitary gland produce lots of TSH. Remember, hormones are chemical messengers. By chemical messengers, I mean that a hormone produced in one place can actually have an effect in another part of the body. Just like you are in Kenya and then you make a call to Nigeria and then you are maybe communicating something. If you are in Kenya and then you call someone in Nigeria and they get the message clearly, they will do exactly what you've told them. So in that way, we said that they've acted just like a hormone. Hormones are produced in one part of the body and then they act in another part of the body. In this particular case, TSH hormone, which is abnormally high, it is being produced from the pituitary gland in the brain, and it's actually supposed to pour in the bloodstream to what we call the thyroid gland. When TSH, thyroid stimulating hormone, reaches the thyroid gland, specifically, it's going to bring about the release of T3 and T4. The question was, why is it that her report is showing that she has high TSH? The number one reason as to why she could be having high TSH hormonal levels is that the thyroid gland could actually be producing less T3 and less T4. But in this particular question, the T3 and T4 was normal. Probably the thyroid gland was actually compensating. It was trying to compensate for the decreasing levels of T3 and T4. And that's why it was kind of like trying to stabilize these hormones by at least trying to bring them within the normal ranges. And probably that's why the report showed that the T3 and the T4 was normal. But in the later times to come or in future, you could realize that since the TSH is abnormally high and the T3 and T4 is actually reducing, then it could actually lead to a condition known as subclinical hypothyroidism. If you are asking yourself, hypothyroidism, what is the meaning of this? Basically, hypo means that less, and then thyroidism is the functioning of the thyroid gland. The thyroid gland is not working or it's not functioning according to its optimal levels. The thyroid gland is kind of underactive. High TSH and normal T3 and normal T4 could actually be indicating that, you know what, much as the TSH is coming in, but the thyroid gland is actually not receiving the correct amount of TSH. It's actually not interpreting the signals of TSH, and in this particular scenario, it is actually producing less T3 and less T4, and that's why TSH is high. I hope, my friend, you've understood the first part of the question. High TSH is due to the brain producing too much TSH. Okay? So high TSH hormonal levels, if you have that report and your report is showing that you have high TSH hormonal levels, it simply means that the pituitary gland, that small part in your brain, is receiving lots of commands, lots of messages from another hormone known as thyrotropin releasing hormone. It means that thyrotropin releasing hormone, TRH, is actually very high. It is exerting lots of force on the pituitary gland, telling it that, you know what, pour or release lots of TSH. And in this particular scenario, it is actually showing on your report that it is high, just simply because the issue is in the brain. Specifically, the issue is within that part known as the pituitary gland. All these issues, why are you having high TSH? Specifically, it could be an issue originating in the brain, originating in that special organ known as the pituitary gland as a result of high TRH hormonal levels. So, if you are asking yourself why TSH is high, I believe by now you know why it is high. The pituitary gland is releasing lots of TSH as a result of high TRH hormone, thyrotropin releasing hormone. Some of the conditions that could manifest when a woman is actually having high TSH and normal T3, normal T4 is actually what we call subclinical hypothyroidism. The thyroid gland, the ability of the thyroid gland to release T3 and T4 is actually going to reduce with time. That's why it's called subclinical. Today, the T3 and T4 could be normal, but because of high TSH coming in and the thyroid gland is not responding, it's not interpreting the high TSH hormonal levels coming in. Remember, hormones communicate. So if the thyroid gland is failing to detect the communication or the messages coming in as a result of high TSH, then it means that a person could end up with a condition known as subclinical hypothyroidism. Subclinical hypothyroidism simply means that the thyroid gland's ability to release T3 and T4 is reducing. Some of the conditions that could bring about this is actually an autoimmune disorder known as Hashimoto's thyroiditis. But there are other conditions that could actually bring about subclinical hypothyroidism. But remember, my videos are for educational purposes only. If you have just received your results and they are actually showing that you have high TSH, it's actually very, very important for you to go to your doctor, and then your doctor will be able to evaluate you, correlate your results, and then they will be able to draw up a plan, a correct plan of action for you. We are learning, we are interpreting your lab results. The results are showing that the TSH is high. By now you know about TSH. Let's go to the next parameter which was covered. Let's go to another hormone which was covered. She said that the TSH was high, and now we know. I've spent some good time talking about TSH, thyroid stimulating hormone. Let's go to the next hormone that is actually high, prolactin hormone. Because on her report, it showed that prolactin was high, TSH was high, testosterone was high, T3 was normal, and T4 was normal. What is the meaning of this? I've finished TSH, we can tick that. So let's go to prolactin. Why is it that TSH was high, but also at the same time, prolactin is also high? Why is it like this? Okay? So, talking about prolactin, prolactin is a hormone that is also produced in the brain, and when it pours into the bloodstream, it goes to a woman's breasts, specifically the breasts, and then it brings about what we call breast milk production. So prolactin causes breast milk to be produced, but it does not cause the breast milk ejection, the release of the milk. No, there's another hormone known as oxytocin, actually, that is responsible for the breast milk release. But breast milk production, it is prolactin. Why is it that your report is showing that TSH is high and prolactin is high? Let's go back to the brain. You see, inside a woman's brain, this hormone I talked about, known as TRH, thyrotropin releasing hormone. Yes, TRH, thyrotropin releasing hormone. When it is high, it's going to cause TSH to be high, okay? It's going to cause the pituitary gland to release lots of TSH. But in the event of bringing about the release of TSH, in the event of causing TSH to be high, it's also going to exert an effect on some special cells inside your brain. These cells are actually cells that deal with prolactin. So, in a nutshell, TRH, thyrotropin releasing hormone, has an effect on raising your TSH levels, but it also has an effect on raising your prolactin hormonal levels. TSH, specifically, TSH, when it is rising, then there are high incidences, or there's actually a big chance that your prolactin will also rise. Why is this so? You realize that thyrotropin releasing hormone will affect two parts or two systems. Thyrotropin releasing hormone will cause your TSH to rise, but at the same time, it will also cause your prolactin to rise because it has an effect on those special cells that produce the prolactin, known as the lactotrophs, okay, in the brain. So your prolactin is high and your TSH is high simply as a result of the effects of this hormone known as thyrotropin releasing hormone, TRH. And that's why it's like that. So my friend, if you are asking yourself, why is this so? Why is your prolactin high and your TSH is high? It starts in the brain as a result of thyrotropin releasing hormone causing TSH to rise, but in the same scenario, it is also affecting your prolactin hormonal levels. In the science of hormones, we call this heteroregulation. One hormone affects one specific part, and then it also affects another specific part. Heteroregulation. But you don't need to go into all these complicated terms. All you need to know is that your TSH is high as a result of thyrotropin releasing hormone in the brain. Now you know why prolactin is high. But remember, there could actually be other causes of you having high prolactin hormonal levels. It's not just the effect of thyrotropin releasing hormone. Stimulation of your breasts as a woman. Maybe you've been with your partner, maybe at night before going for the test the next day. Maybe you had intercourse, like at night there was stimulation of your nipples, okay, during sexual intercourse. And maybe you, like early in the morning, you went and then you did the test after chest stimulation, after stimulating your nipples, maybe during romancing yourself, during romance, okay, when you're having sex, you could realize that this could actually contribute to high prolactin hormonal levels. So prolactin can rise as a result of breast stimulation, chest stimulation. It's advisable that if you are going to do the prolactin test tomorrow, probably you could maybe abstain a bit for that night and then you go and do the test tomorrow, because if you have intercourse at night and you do the test in the morning, the levels are going to be high. Remember, the normal prolactin levels are supposed to be at least between 0 up to 25. Okay? So let's go ahead with our question about high prolactin. So the commonest reasons as to why your prolactin could rise: number one, it could be due to chest stimulation or breast stimulation during intercourse or some other activities, and then it could also be due to the effects of thyrotropin releasing hormone. Okay, talked about that, starting in the brain. The other reasons as to why your prolactin could rise could actually be due to medications a woman is taking. If a woman is on medications that specifically treat mental conditions like maybe psychosis, we call these antipsychotics. Some of them tend to actually cause your prolactin to rise. So if you have done the test and it is showing that your prolactin hormonal levels are high, and at the same time you are on medications for depression, you are on medications for anxiety, you are on medications for depression, persistent low moods, some of these medications could actually cause your prolactin to rise. You need to discuss this with your doctor, who will look into whether to adjust or to make some changes. Next reason as to why your prolactin could actually rise could be due to some growths. We call these swellings in the brain. Specifically, we call these prolactinomas. This could actually cause lots of prolactin to rise. If you are asking yourself why prolactin is high, it could actually be due to any of the mentioned points I've just talked about. I've talked about medications, okay? I've talked about breast stimulation before doing the test. It could lead to high prolactin hormone levels. I've talked about as it could be a result of what we call thyrotropin releasing hormone. Now you know about prolactin, why prolactin is high on your report. You know why TSH is high on your report. Okay? If you've not got the concept, you can go back after finishing the video. You can go back and rewatch it again so that it could help guide you. It could help you understand your report. But still, if you do not understand the things and you need a one-on-one session with me, one-on-one consultation with me, it's very okay. My numbers are actually just below here. Then at the end of this video, my numbers are attached. You can always reach me and then we can have a one-on-one consultation at only $10 per session. Let's go to the next part as to why your results are showing that everything is actually not really within the normal ranges. I've talked about TSH, you know why TSH is high. I've talked about prolactin, you know why prolactin is high. Let's go to the next hormone, which is actually high. Okay, this hormone is known as testosterone. Remember in the report, it was showing that her prolactin hormonal levels was high, her testosterone was high, and then also she's having what we call high TSH. I've finished TSH, I've finished prolactin, now I'm talking about testosterone. Testosterone is a normal hormone that is actually found in men and in women. In men, it's actually supposed to be within some certain ranges, and then in women, it's also supposed to be within some certain ranges. So, if at all the results come out, and this is a man, and the testosterone hormonal levels are high, they could actually point to some changes that are happening. First of all, we need to understand that testosterone hormonal levels, or testosterone as a hormone, in men, it is actually very, very useful in bringing about changes in a man. For example, causing the male pattern appearance. For example, the breasts, for example, the beards coming out, okay? It's the result of testosterone hormonal levels. And then it's also responsible for the voice changes in a man. At first, this child, baby, like the boy, when he was growing up, the voice was really kind of like soft, but as this boy becomes a man, the voice changes. One of the hormones that brings about these changes in the voice is actually what we call testosterone. So, if the results come out and they show that testosterone hormonal levels is abnormally high, then it could actually be an indication, or it could be a reason that something is not happening. Either we go back to where the testosterone is produced. Testosterone in men, it's produced in the testes, okay? And then it's also produced in some special cells on the adrenal glands. The adrenal glands are those small glands on the kidneys. So if your testosterone is abnormally high and you are a man, it could be an issue in the testes. In Uganda, we call this ensigo. And then it could also be an issue on the adrenal glands. Maybe they are producing lots of testosterone. There are conditions that could bring about this, okay? One of the commonest conditions is actually what is known as the congenital adrenal hyperplasia, which is of late onset, okay? Much as this condition is so common in early childhood, but it could also be of late onset. We call this congenital adrenal hyperplasia. But remember, high testosterone does not purely indicate that you are having the congenital adrenal hyperplasia. You need to discuss with your doctor who will do a proper diagnosis. My videos are for educational purposes only. If your report is showing that your testosterone is high, then it could be an issue in the testes, you as a man, and then it could also be an issue of the adrenal glands. How can you tell that you as a man, the high testosterone is actually, or the low testosterone is actually being brought about by issues in the testes? You could actually experience difficulties making a woman pregnant. If a man is having issues with his testosterone, maybe it is very high or it is very low, this particular man could have difficulties making the woman pregnant, okay? Next reason as to why your testosterone could actually be abnormally high is that it could be due to some certain medications. Some certain medications could also affect a man's testosterone hormonal levels. You could ask yourself, what are these other medications Gerald is talking about, okay? There are men who want to boost their testosterone and they go and get what we call exogenous testosterone injections, or they get injections of testosterone and then they begin injecting themselves without going to hospital. This is wrong. You are supposed to go to your doctor, reproductive endo, and then your doctor will be able to guide you on which type of testosterone you are supposed to be getting, and then of course look at other parameters. Which dosages are you supposed to get, okay? So my videos are for educational purposes only, but if you are a man and you are looking at getting or starting on testosterone therapy, or you would like to build more mass, you're a body lifter and you want to maybe become big and then build more muscles, you need to go to your doctor who will be able to guide you on this, okay? So if you are over-injecting yourself with injections of testosterone, then it could actually be another reason as to why your testosterone is high. That is in men. High testosterone in women. In this particular question, she's a lady. She said that her report showed that prolactin was high, TSH was high, and testosterone was high. So in women, testosterone being high could also be an indication that there's something happening on the ovaries. It could also be an indication that there's something happening on her adrenal glands on the kidneys. On the ovaries, she could actually be developing a condition known as polycystic ovarian syndrome, PCOS. But remember, this has to be confirmed by your doctor. Let me try to summarize. It's been a lengthy video. So, if your report is showing that TSH is high, then it actually could be pointing us towards something that is happening in the brain. Maybe there's an abnormal growth in the brain, in the pituitary gland, and this is actually causing your pituitary gland to actually release lots of TSH. There could be something that is happening with a hormone known as thyrotropin releasing hormone. There could be something happening in such a way that the thyroid gland is not responding to the high to the TSH levels. Thereby, the TSH will get more messages that you poor, and then of course it will be much more higher. The other point is that your prolactin could be rising due to maybe you maybe having breast stimulation the night before going for the test. You had intercourse at night with your partner, and then you went for the test in the morning. It could actually give those results. It could also be due to the effects of thyrotropin releasing hormone. Okay, remember, thyrotropin releasing hormone causes TSH to rise, but it also causes the prolactin to rise. Okay, it affects too. Next reason as to why your prolactin could be high is that it could be due to some certain medications, like, for example, medications known as the selective serotonin reuptake inhibitors, SSRIs, drugs used to treat depression, drugs used to treat anxiety, okay? Antipsychotic medications could actually have an effect on your prolactin hormonal levels. Next reason as to why you could actually be having high testosterone hormonal levels, you as a woman, could be one of the early signs that maybe you're going towards PCOS. It could also be an indication that maybe there's something to do with maybe the adrenal glands on your kidneys. Conditions like late onset congenital adrenal hyperplasia. T3 and T4 was normal, it was within the normal ranges, so I will not overdwell on it, but the T3 and T4 being within the normal ranges, but with high TSH on this side, it could actually be a compensatory mechanism. The thyroid gland could be compensating. Remember, the organs in the body, they keep compensating until eventually they fail to compensate, and then disease comes in. So the thyroid gland could actually be releasing T3 and T4, but as a compensatory mechanism. It's trying to compensate with the issues, okay? It's trying to cover up for the issues that are happening in the brain, okay? But eventually, they could actually, the person could actually end up with what we call subclinical hypothyroidism. It's been a lengthy video, but in this particular scenario, or in this particular moment, I'm requesting that if you are looking at learning about hormones, you would like someone to interpret your hormone results. You need someone to teach you about your hormone results, what they mean. You've done the fertility hormonal test, and then they are actually giving you levels. I mean, they are showing you things you're not understanding, things of AMH, things of testosterone, things of prolactin, things of TSH, things of the DHEAs, the dihydroepian androsterones, the androstenediones. They are actually high and maybe they are low. You need someone to put them together for you, to simplify them for you. Then I'm right here. I'm called Gerald Massa, and I'm a certified and licensed hormone health coach. You can also ask me all your questions in the comments. I'll be able to answer all your questions. It's been a lengthy video. I thank God for this opportunity that you've spent all this time watching. If you've watched this video up to this particular moment, because most people, like, they cannot handle, like, they are so busy, they cannot tolerate lengthy videos. But if you've watched up to this point, then it means that deep in your heart, you really feel that you really needed this information. So I'm really so happy, and I thank God for this opportunity that you've spent some of your time watching this video, and I hope you've learned something. If you've actually learned something, please let me know in the comments below, and then yeah, let's talk more in the next video. Okay, I'm going to repeat the same video in Luganda, our local language here in Uganda. And if you are okay with the Luganda language, please, on the next video upload, please check. The next video is going to be in Luganda. Video agenda okuddako egenda kubeera mu Luganda naye ngenda kuddamu bino bye mbadde njogerako. So thanks a lot, my friend. I really appreciate this moment I've spent with you. Have yourself a fantastic evening. It's coming to evening here in Uganda, so have yourself a fantastic evening. Let me see you in the next video. May God bless and guide us all. Bye bye.